This is one question, Dr. Sunil. I would love to get your views. Is there crisis in alcoholism or alcohol addiction? Should a family be shy enough to say that there is a crisis? I have had somebody doing this over and over again. I don't know where to reach out. And how should, as families or as an individual, they should manage crisis?
Absolutely. When we are talking about a crisis in a general medical front, it's very easy that if somebody is unconscious, yes, it's a crisis. Somebody's broken his bone, it's a crisis, it's an emergency. But when it comes to alcohol issues, or for that matter, general, broader, psychological issues, when do you consider it to be a crisis? Because it's a threshold that unfortunately the family has. So for some families, a minor issue could be a crisis. For some families, a major issue can be a crisis. Otherwise, they generally try to manage. But we need to recognize that there is something called a crisis or an emergency when there is a problem related to alcohol. Here I would like to categorize them into two different broader aspects or spaces there. One is the person has taken alcohol and he's completely intoxicated.
Right.
And he's intoxicated to an extent that he is knocked out and he is not responding. And people, when they take alcohol, many of them have the habit of not having food regularly, which can lead to hypoglycemic episodes, the sugar levels dropping, or if the physical health is not good, they might have passed out. That's one crisis, which is purely a medical crisis, when people have the habit of rushing them to the general hospital and going to the emergency department, where the medical problem is addressed and they're said, you have got alcohol problem, you go, and he goes back and again he drinks alcohol. That's one. Second, under the influence of alcohol, this is where the issue or the gray area that comes in. He's behaving abnormally.
Right.
Okay. And when he's behaving abnormally, what do the family do? Okay. Do they tolerate? Do they just bear with the behavioral problems that this individual, he could be physically abusive, he could be verbally abusive, or he could be just going out and spoiling their name and speaking, creating whole havoc at their social situation. That is also, and that should also be considered as a crisis where they have to seek mental health professionals' help. As I said, in the second, the former one, it's the tolerance levels of the family, and also probably the socioeconomic strata of the family also comes into picture, and each one have their own way of dealing with it, and they manage.